Hi, I'm going to be speaking about the Catastrophic Sports Injury Simulation. This simulation has been in existence for nearly a decade and was originally conceived, designed, and has been taught by Andrew Steckler, myself, Dr. Tom Waters, and Dr. Paul Saluan. The purpose of this simulation is to provide the orthopedic surgery residents, the sports medicine fellows, sports medicine athletic trainers, and physical therapists with hands-on learning on how to care for the most catastrophic sports injuries in real-life situations on the field, in the dugout, on the court, or anywhere a sports injury may occur. We've been teaching this course for 10 years and originally started in the lab, but over the last 3 to 4 or 5 years, we've actually taken the course in situ to the athletic setting, and we have taught the course on various athletic venues at John Carroll University. This year's course was a 3-day event, initially kicked off with a didactic lecture by myself discussing an introduction to on-field emergencies and giving an overview of any and all types of situations that might arise while covering. The important thing about this course is that it's a refresher every year prior to the beginning of the fall sports season for any and all caregivers who are going to be involved in caring for our various sports teams that we cover throughout the year, be it high school, college, or professional teams. Some of the scenarios that we simulate and practice include an athlete who is down in a supine position with concern for cervical spine injury. This allows us to simulate how to assess a patient, stabilize their C-spine, secure their C-spine backboard, and load them onto the gurney and or golf cart, depending on what the situation dictates. We also have a scenario of a downed athlete, very similar, with a potential C-spine injury, but they are prone, so you need to work on securing the C-spine and rolling them safely while maintaining C-spine precautions. We then move on to have a unresponsive and athlete who goes into cardiac arrest, which allows the learners to practice their CPR as well as deployment of an AED. Which has proven to be extremely beneficial and a skill that has actually been utilized in the last 365 days when a referee suffered cardiac arrest at a John Carroll athletic event and was saved because of the skills learned in this course. We have other scenarios that include tension pneumothorax and simulation of applying needle decompression to the chest, and we have also had other situations with fracture dislocations in the past as well. The main outcome of this training is to provide residents, fellows, athletic trainers, and physical therapists with the framework to respond to a catastrophically injured athlete. These are very stressful situations and they rarely occur under ideal circumstances, especially in the sporting setting. Often it may be raining, cold, wet, hot, sweaty. So by taking this simulation into the field and recreating these real life situations, it gives our caregivers and our learners the opportunity to practice this before they're under the hot lights of Friday Night Football or somewhere else. Our next steps, in years past, we've held the simulation as a 1-day event, and after experimenting with 2 and 3 days, we have found that the 1-day event may be most beneficial to learners as well as the organization of the course. And next year we are going to be back on site at John Carroll University with a lecture followed by a full 1-day course for our learners. If you have any questions, please direct them to Andrew Steckler or Dr. Saluan or myself, and appreciate the time. Have a great day.